performance by avoiding practices that create unacceptably low energy availability and psychological stress. 6. Training and nutrition have a strong interaction in acclimating the body to develop functional and metabolic adaptations. Although optimal performance is underpinned by the provision of proactive nutrition support, training adaptations may be enhanced in the absence of such support. 7. Some nutrients, e.g., energy, carbohydrate, and protein, should be expressed using guidelines per kg body mass to allow recommendations to be scaled to the large range in the body sizes of athletes. Sports nutrition guidelines should also consider the importance of the timing of nutrient intake and nutritional support over the day and in relation to sport rather than general daily targets. 8. Highly trained athletes walk a tightrope between training hard enough to achieve a maximal training stimulus and avoiding the illness and injury risk associated with an excessive training volume. 9. Competition nutrition should target specific strategies that reduce or delay factors that would otherwise cause fatigue in an event. These are specific to the event, the environment/scenario in which it is undertaken, and the individual athlete. 10. New performance nutrition options have emerged in the light of developing but robust evidence that brain sensing of the presence of carbohydrate, and potentially other nutritional components, in the oral cavity can enhance perceptions of well-being and increase self-chosen work rates. Such findings present opportunities for intake during shorter events, in which fluid or food intake was previously not considered to offer a metabolic advantage, by enhancing performance via a central effect. 11. A pragmatic approach to advice regarding the use of supplements and sports foods is needed in the face of the high prevalence of interest in, and use by, athletes and the evidence that some products can usefully contribute to a sports nutrition plan and/or directly enhance performance. Athletes should be assisted to undertake a cost-benefit analysis of the use of such products and to recognize that they are of the greatest value when added to a well-chosen eating plan. Back to top article outline. Theme 1. Nutrition for athlete preparation. Energy requirements, energy balance, and energy availability. An appropriate energy intake is the cornerstone of the athlete's diet since it supports optimal body function, determines the capacity for intake of macronutrient and micronutrients, and assists in manipulating body composition. An athlete's energy intake from food, fluids, and supplements can be derived from weighed/measured food records, typically 3-7-day, a multi-pass 24-hour recall, or from food frequency questionnaires. Point 1. There are inherent limitations with all of these methods, with a bias to the underreporting of intakes. Extensive education regarding the purpose and protocols of documenting intakes may assist with compliance and enhance the accuracy and validity of self-reported information. Meanwhile, an athlete's energy requirements depend on the periodized training and competition cycle, and will vary from day to day throughout the yearly training plan relative to changes in training volume and intensity. Factors that increase energy needs above normal baseline levels include exposure to cold or heat, fear, stress, high altitude exposure, some physical injuries, specific drugs or medications, e.g., caffeine, nicotine, increases in fat-free mass, and, possibly, the luteal phase of the menstrual cycle. Point 2. Aside from reductions in training, energy requirements are lowered by aging, decreases in fat-free mass, FFM, and, possibly, the follicular phase of the menstrual cycle. Point 3. Energy balance occurs when total energy intake, EI, equals total energy expenditure, T, which in turn consists of the summation of basal metabolic rate, BMR, the thermic effect of food, TEF, and the thermic effect of activity, T. Equation, unseated, equation, unseated, image tools. Equation, unseated, equation, unseated, image tools. Techniques used to measure or estimate components of T in sedentary and moderately active populations can also be applied to athletes, but there are some limitations to this approach, particularly in highly competitive athletes. Since the measurement of BMR requires subjects to remain exclusively at rest, it is more practical to measure resting metabolic rate, RMR, which may be 10% higher. Although population-specific regression equations are encouraged, a reasonable estimate of BMR can be obtained using either the Cunningham 4 or the Harris-Benedict 5 equations, with an appropriate activity factor being applied to estimate T. Whereas RMR represents 60%, 80% of T for sedentary individuals, it may be as little as 38%, 47% of T for elite endurance athletes who may have a T as high as 50% of T. Point 2. T includes planned exercise expenditure, spontaneous physical activity, e.g., fidgeting, and non-exercise activity thermogenesis. Energy expenditure from exercise, EEE, can be estimated in several ways from activity logs. 1. 7 days duration, with subjective estimates of exercise intensity using activity codes and metabolic equivalents, METs, 6,7 2015 U.S. Dietary Guidelines 8 and the Dietary Reference Intakes, DRIs. Point 9. The latter two typically underestimate the requirements of athletes since they fail to cover the range in body size or activity levels of competitive populations. Energy availability, EA, is a concept of recent currency in sports nutrition, which equates energy intake with requirements for optimal health and function rather than energy balance. EA, defined as dietary intake minus exercise energy expenditure normalized to FFM, is the amount of energy available to the body to perform all other functions after the cost of exercise is subtracted. Point 10. The concept was first studied in females, where an EA of 45 kcal/kg FFM/D was found to be associated with energy balance and optimal health. Meanwhile, a chronic reduction in EA, particularly below 30 kcal/kg FFM/D, was associated with impairments of a variety of body functions. Point 10. Low EA may occur from insufficient EI, high T, or a combination of the two. It may be associated with disordered eating, a misguided or excessively rapid program for loss of body mass, or inadvertent failure to meet energy requirements during a period of high-volume training or competition. Point 10. Example calculation of energy availability: EA 60 kg body weight, BW 20% BF, 80% FFM, equals 48.0 kg FFM, EI equals 2400 kcal/D, EE equals 500 kcal/DEA equals, EE/FFM equals 2400, 500 kcal/D/48.0 kg equals 39.6 kcal/kg FFM/D. The concept of EA emerged from the study of female athlete triad, which started as a recognition of the interrelatedness of clinical issues with disordered eating, menstrual dysfunction, and low bone mineral density in female athletes, and then evolved into a broader understanding of the concerns associated with any movement along the spectra away from optimal energy availability, menstrual status, and bone health. Point 11. Although not embedded in the triad spectrum, it is recognized that other physiological consequences may result from one of the components of the triad in female athletes, such as endocrine, gastrointestinal, renal, neuropsychiatric, musculoskeletal, and cardiovascular dysfunction. Point 11. Indeed, an extension of the triad has been proposed, relative energy deficiency in sport, REDS, as an inclusive description of the entire cluster of physiological complications observed in male and female athletes who consume energy intakes that are insufficient in meeting the needs for optimal body function once the energy cost of exercise has been removed. Point 12. Specifically, health consequences of REDS may negatively affect menstrual function, bone health, endocrine, metabolic, hematological, growth and development, psychological, cardiovascular, gastrointestinal, and immunological systems. Potential performance effects of REDS may include decreased endurance, increased injury risk, decreased training response, impaired judgment, decreased coordination, decreased concentration, irritability, depression, decreased glycogen stores, and decreased muscle strength. Point 12. It is now also recognized that impairments of health and function occur across the continuum of reductions in EA, rather than occurring uniformly at an EA threshold, and require further research. Point 12. It should be appreciated that low EA is not synonymous with negative EB or weight loss. Indeed, if a reduction in EA is associated with a reduction in RMR, it may produce a new steady state of EB or weight stability at a lowered energy intake that is insufficient to provide for healthy body function. Regardless of the terminology, it is apparent that low EA in male and female athletes may compromise athletic performance in the short and long term. Screening and treatment guidelines have been established for management of low EA 11,12 and should include assessment with the Eating Disorder Inventory 3 Resource 13 or the DSM-5, which includes changes in eating disorder criteria. Point 14. There is evidence that interventions to increase EA are successful in reversing at least some impaired body functions. For example, in a 6-month trial with female athletes experiencing menstrual dysfunction, dietary treatment to increase EA to 40 kcal/kg FFM/D resulted in resumption of menses in all subjects in a mean of 2.6 months. Point 6. Back to top article. Outline body composition and sports performance. Various attributes of physique, body size, shape, and composition are considered to contribute to success in various sports. Of these, body mass, weight, and body composition are often focal points for athletes since they are most able to be manipulated. Although it is clear that the assessment and manipulation of body composition may assist in the progression of an athletic career, athletes, coaches, and trainers should be reminded that athletic performance cannot be accurately predicted solely based on body weight and composition. A single and rigid optimal body composition should not be recommended for any event or group of athletes. Point 15. Nevertheless, there are relationships between body composition and sports performance that are important to consider within an athlete's preparation. In sports involving strength and power, athletes strive to gain fat-free mass via a program of muscle hypertrophy at specified times of the annual macro cycle. Whereas some athletes aim to gain absolute size and strength per SC, in other sports, in which the athlete must move their own body mass or compete within weight divisions, it is important to optimize power-to-weight ratios rather than absolute power. Point 16. Thus, some power athletes also desire to achieve low body fat levels. In sports involving weight divisions, e.g., combat sports, lightweight rowing, weightlifting, competitors typically target the lowest achievable body weight category, while maximizing their lean mass within this target. Other athletes strive to maintain a low body mass and or body fat level for separate advantages. Point 17. Distance runners and cyclists benefit from a low energy cost of movement and a favorable ratio of weight to surface area for heat dissipation. Team athletes can increase their speed and agility by being lean, while athletes in acrobatic sports, e.g., diving, gymnastics, dance, gain biomechanical advantages in being able to move their bodies within a smaller space. In some of these sports and others, e.g., bodybuilding, there is an element of aesthetics in determining performance outcomes. Although there are demonstrated advantages to achieving a certain body composition, athletes may feel pressure to strive to achieve unrealistically low targets of weight/body fat or to reach them in an unrealistic time frame. 15. Such athletes may be susceptible to practicing extreme weight control behaviors or continuous dieting, exposing themselves to chronic periods of low EA and poor nutrient support in an effort to repeat previous success at a lower weight or leaner body composition. 15, 18. Extreme methods of weight control can be detrimental to health and performance, and disordered eating patterns have also been observed in these sports scenarios. 15, 18. Nevertheless, there are scenarios in which an athlete will enhance their health and performance by reducing body weight or body fat as part of a periodized strategy. Ideally, this occurs within a program that gradually achieves an individualized optimal body composition over the athlete's athletic career, and allows weight and body fat to track within a suitable range within the annual training cycle. 18. The program should also include avoiding situations in which athletes inadvertently gain excessive amounts of body fat as a result of a sudden energy mismatch when energy expenditure is abruptly reduced, e.g., the off-season or injury. In addition, athletes are warned against the sudden or excessive gain in body fat, which is part of the culture of some sports where a high body mass is deemed useful for performance. Although body mass index is not appropriate as a body composition surrogate in athletes, a chronic interest in gaining weight may put some athletes at risk for an obese body mass index, which may increase the risk of meeting the criteria for metabolic syndrome. 19. Sports dietitians should be aware of sports that promote the attainment of a large body mass and screen for metabolic risk factors. 19. Back to top article outline methodologies for body composition assessment. Techniques used to assess athlete body composition include dual energy X-ray absorptiometry, DXA, hydrodensitometry, air displacement plethysmography, skin fold measurements, and single and multi-frequency bioelectrical impedance analysis. Although DXA is quick and non-invasive, issues around cost, accessibility, and exposure to a small radiation dose limit its utility, particularly for certain populations. 20. When undertaken according to standardized protocols, DXA has the lowest standard error of estimate while skin fold measures have the highest. Air displacement plethysmography, BODPOD, Life Measurement, Inc., Concord, CA, provides an alternative method that is quick and reliable, but may underestimate body fat by 2%, 3%. 20. Skin fold measurement and other anthropometric data serve as an excellent surrogate measure of adiposity and muscularity when profiling composition changes in response to training interventions. 20. However, it should be noted that the standardization of skin fold sites, measurement techniques, and calipers vary around the world. Despite some limitations, this technique remains a popular method of choice due to convenience and cost, with information being provided in absolute measures and compared with sequential data from the individual athlete or, in a general way, with normative data collected in the same way from athlete populations. 20, 21. All body composition assessment techniques should be scrutinized to ensure accuracy and reliability. Testing should be conducted with the same calibrated equipment, with a standardized protocol, and by technicians with known test-retest reliability. Where population-specific prediction equations are used, they should be cross-validated and reliable. Athletes should be educated on the limitations associated with body composition assessment and should strictly follow pre-assessment protocols. These instructions, which include maintaining a consistent training volume, fasting status, and hydration from test to TEST20, should be enforced to avoid compromising the accuracy and reliability of body composition measures. Body composition should be determined within a sports program according to a schedule that is appropriate to the performance of the event, the practicality of undertaking assessments, and the sensitivity of the athlete. There are technical errors associated with all body composition techniques that limit the usefulness of measurement for athlete selection and performance prediction. In lieu of setting absolute body composition goals or applying absolute criteria to categorize groups of athletes, it is preferred that normative data are provided in terms of ranges. 21. Since body fat content for an individual athlete will vary over the season and over the athlete's career, goals for body composition should be set in terms of ranges that can be appropriately tracked at critical times. When conducting such monitoring programs, it is important that the communication of results with coaches, training staff, and athletes is undertaken with sensitivity, that limitations in measurement technique are recognized, and that care is taken to avoid promoting an unhealthy obsession with body composition. 17, 18. Sports dietitians have important opportunities to work with these athletes to help promote a healthy body composition, and to minimize their reliance on rapid weight loss techniques and other hazardous practices that may result in performance decrements, loss of fat-free mass, and chronic health risks. Many themes should be addressed and include the creation of a culture and environment that values safe and long-term approaches to management of body composition, Modification of rules or practices around selection and qualification for weight classes, 16,19,22, and programs that identify disordered eating practices at an early stage for intervention, and where necessary, removal from play. Point 18 back to top article outline principles of altering body composition and weight. Athletes often need assistance in setting appropriate short-term and long-term goals, understanding nutritional practices that can safely and effectively increase muscle mass or reduce body fat/weight, and integrating these strategies into an eating plan that achieves other performance nutrition goals. Frequent follow-up with these athletes may